friends, I'm Dr. Vinant Bhargava. I'm a senior consultant nephrologist at Sir Gangaram Hospital. And today I will be talking to you about diabetes and its complications, especially associated with kidney, and it is called as diabetic kidney disease. So diabetic kidney disease involves involvement of parts of the kidney, because of which over a long period of time there is loss in kidney function. The first and foremost important thing in diabetic kidney disease is the presence of proteinuria. So there is some amount of protein which is getting excreted from the urine because of damage of the glomerular apparatus from diabetes, uncontrolled diabetes. When this occurs and there's loss of protein from the urine, and if it is not detected in time, patients will develop slow decline in kidney function, which in turn may also give rise to retention of water in the body, because of which swelling takes place in patients who have diabetic kidney disease, which causes increase in blood pressure, and so you have hypertension. So the common symptoms of diabetic kidney disease is swelling in the body, presence of protein in the urine, increasing blood pressure, weakness, letharginess, and when you get your testing done, you will see that serum creatinine has gone above 1, with presence of urinary proteins more than 150 milligrams in 24 hours. But however, there is a good news that though you can develop diabetic kidney disease because of uncontrolled diabetes, but this is generally a disease which can be slowed down. So mark my words, it can be slowed down, it cannot be reversed after a particular stage of diabetic kidney disease. Especially so when the proteinuria is increased more than 300 milligrams and touches about 1000 milligrams in 24 hours. Only 1/3 of these patients with strict diabetic control can have reversal of their kidney disease. Rest of the 2/3 will progress over a period of 6 to 7 years to overt or excessive proteinuria, which is more than 2.5 grams, which is also called as nephrotic range proteinuria in the presence of low serum albumin. So once you have controlled the blood pressure, once you have controlled diabetes, once you have controlled intake of salt, because of which there is volume retention, you can have slowing down of diabetic kidney disease. Apart from kidneys, diabetes also affects the retina, and so you have nearly 60% of patients who are type 2 diabetes with retinopathy having diabetic kidney disease, and nearly 90% of patients with retinal involvement having diabetic kidney disease in type 1 diabetes, which is also known as maturity onset diabetes, or even diabetes in the very young people, such as 10 years to 13, 14 years. So it's very important, my dear friends, to have regular checkup of your urine, especially if you're diabetic and have been having diabetes for more than 5 years. Also check your retina every 2 to 3 years if you don't have very well controlled diabetes. Once you have protein leakage from the kidney, you should go to a nephrologist and also do some lifestyle management changes, such as weight loss, cut down, or maybe even stop smoking or tobacco, which is known to cause progression of this disease. Also, certain alternative medications which are available in the market for weight loss as well as for gaining muscle mass are also known to cause more of protein leakage. So in the end, I would say that early detection of this disease is very important, which can take place only if you regularly monitor your blood sugars and do annual checkups, especially if you're diabetic or you have a family history of diabetes or a family history of diabetic kidney disease. More so, even if you do lose your kidney functions over a period of time and you go on to a condition called as dialysis, in which you have to undergo a procedure of cleaning your blood through a machine every third or second day for 4 hours session, there is still a hope of getting your transplantation done or replacing the affected organ, which is the kidney in this case. So in conclusion, though diabetic kidney disease is a serious complication of diabetes, but is not life-threatening if you take good care of yourself, especially if you have healthy lifestyle, you have regular monitoring, and you have good control of blood sugar as well as hypertension. So remember, prevention is the key, and it's important to identify a good healthcare system that can support whatever complications you have. And thank you for your attention. And please take care of yourselves and get yourself checked regularly. And hope you do well and have good health in your life. Thank you.